Those who have a straight back posture did gluteus maximus exercises. The core needs to be relaxed before moving on to the lower body. Core is not just abs. The core is the part that surrounds the hole from the middle of the stomach to the lower part of the hip. Straight back posture people have a body shape that pushes the pelvis forward. This can put pressure on the lumbar spine. What is happening in the front? You keep pushing forward. There is an important Illipsoas muscle which is continuously pressed forward. To put it simply, you are leaning your weight in the Illipsoas muscle. You can think like this. Let me explain about Illipsoas muscle. The muscle attaches to the lumbar spine and passes through the front of the pelvis. It is attached to the inside of the femur. I said it started with the waist. It starts at the lumbar spine, crosses the pelvis, and attaches to the inside of the femur bone. Weight is shifted forward. You can think of it as carrying your weight on the iliopsoas muscles. Anyone who has this posture, the buttocks couldn't contract, and the buttocks are all lying down with a posterior tilt. Then what happens to the iliopsoas muscles? As it stretches, it becomes very stiff. Let me explain it easily. Because you're still leaning your weight on the iliopsoas muscle, the muscles are bound to be stiff. I said that the position of the pelvis is lying on the back like this, in the form of posterior tilt. This will increase the length of the iliopsoas muscle, and because your weight keeps pushing the iliopsoas forward, the muscle continues to struggle. As a result, it is getting hard and stiff. Then, before exercising the iliopsoas, stiff muscles need to be loosened first, and then you exercise. Not all muscles work out stiff. After loosening the muscles, you need to exercise to keep your body healthy. Another problem arises when the muscles are stretched and stiff. There are people with unknown pain in the hip joint. There is nothing wrong with going to the hospital and it comes out normal. You just have to think about the position of the psoas major. The iliopsoas muscle is attached to the lower back and attached to the inside of the femur. Start at the waist. The ending point is on the inside of the femur. When the muscles are stretched, the center of the muscles is not uncomfortable. Tendons that attach to bones are difficult. Inflammation can easily occur. Stiff muscles need to be relaxed to prevent inflammation while moving or standing still. Unknown complaints in the hip joint area. Some people have bad pain. Unless they have a special problem, there is a very high probability of stiffness of the iliopsoas muscle. The first thing to do is to loosen this muscle first. I will tell you how to relax these muscles. Lying straight on the floor. Put your thumb on the front part of the pelvis. From the bottom up like this. The ASIS point is palpable. Part that sticks out the most is ASIS. Draw a diagonal line between the ASIS and the navel. The center of the oblique line is the that can promote the iliopsoas muscle. We will learn how to self-relax. It is hard with your own hand. Use a peanut ball. Place the ball on the center of the diagonal line and exhale. Go in slowly. Not for people with organ problems. It is for healthy people. Exhale slowly and press lightly. When you stop breathing, without removing the peanut balls, while holding down, breathe in again and push harder on the exhale. Stop breathing again. As you exhale again, push in deeply again. You don't need to overdo it. The position of the iliopsoas muscle is a little deep. Abdomen is a superficial surface because the muscle is attached to the spine. You have to go a little deeper. There is a discomfort in the hip joint. And for those who have discomfort in the lower back, when you relax like this, there may be some pain. I'm talking about stiff pain. You should release this muscle by moving the ball slightly. Do the same on the other side. Breathe out when the peanut ball goes inside. 3 times without lifting the ball again. You are pushing it in slowly. Most of the time, one side is more inconvenient as to what kind of phenomenon occurs. Both are uncomfortable. There are many people who are more uncomfortable with one side. You can relieve a lot of the side that you're most uncomfortable with. Release it appropriately for 20 seconds and 30 seconds. Loosen lightly and do not overdo it. It is a self-relaxation that you do yourself, but you do it gradually. After you relax, you need to exercise. Next, I will tell you about the iliopsoas exercise.